Hello, we can't hear a thing.
Guys,
yeah, now.
Okay. Guys, for okay. Okay. So let's continue from where we are, and we are going to speed up. Yes, we are going to speed up so that to cover for the time that I had taken from you. So from the outline that we are going to do, we are going to talk on of what is sexuality and highlight the connectivity between sexuality, autism, and occupational therapy. And we are also going to talk about the common problems that parents usually complain about. And also, I'm going to answer some questions that you are going to raise. And I'm also going to highlight some of the sources where you can go and just view some of the journeys that other people on the spectrum have taken, some of the journeys of other people. And I think it's going to help another person. So, on sexuality, so generally when we are talking about sexuality, we are talking about human beings, our lives. Our lives are all sexuality. In what sense? It is we are talking about an attribute that each and every person can contribute. We are talking about the deeper needs that someone has for identity. We are talking about relationship. We are talking about love. We are talking about immortality. Okay, so we're talking is more than just biology. It's more than just gender. It consists of physiological processes that we have okay.
Usually customers stop coming in the house fix, the station. I was like a very frustrated. Very loyal customers. Lots of my customers come from Sweden. And you go to Sweden on your own? No, it's not complicated.
Okay. Can you hear me now, guys? Can you hear me now?
Yeah, it's okay.
Okay. So can you please stay on camera so that we can use your feed, because my network is behaving very funny here. So once I
Okay, it's
unmute
fine.
my microphone, you'd find out it's acting very funny, and it's going to disturb everything that we had done. And so I've tried to just to involve your microphone. So
Oh,
we were on the outline, right? So that we can go ahead and start the definition of sexuality and what we mean when we are talking of sexuality. Okay. So
yeah.
okay, so we are going on sexuality. So I was taking, I was saying sexuality is at the center of everything that we are as human beings. It talks about the gender, the need for emotions, the need for recognition from someone else, and the need for physical touch, all those things that we have. And it also encompasses a lot of things that we can talk of: sexual behavior, communication, relationships, everything. And how we express each other, and how the other partner or we have informing partner, a lot of things is stem out of the term sexuality. So you'd find out I've taken this broader view of sexuality, and just wanted to have parents and everyone who's attending to have an overview. What do we mean when we are talking of sexuality, and what we usually see in children on the spectrum, and how we can solve some of the issues, the problems that they have that stem out of issues like sexuality. So you'd find out sexuality is central to our kids' lives, central to everyone, central to our lives. You'd find out even in the normal settings, everyone is working to just have this satisfaction, to have the other partner to say, yes, it is. So sexuality, you'd find out we're talking of the capacity for sexual feelings. We are talking of gender identities, gender roles. What can you do as a man? What is expected of you in the society is part of sexuality. You'd find out in some cultures it's not appropriate for a man to find bearing
हाँ. Hello.
To be added, free to make this a good presentation for everyone. So can everyone is here is hearing, right? Can everyone hear me now?
Yes, you're audible now.
Okay, so I'll take a little bit at sexuality. I was just getting deep sexuality and how can we see it in children that are on the spectrum. So as I said earlier on, we are just going to take it as a broader view because it consists of a lot of things. So I defined it a little bit, mentioning about the need to have affection, the need to have approval, about the gender, about relationship, all of those things. So these are fine details that I want to get deeper to it. So I was saying sexuality, when we are talking about sexuality, the other things that should ring in the minds of everyone is things like capacity for sexual feelings is part of sexuality, and gender identity and gender roles. Or we will be talking about what is expected of you. If they are saying in your community, men are now going, what is that they expect that men can do when you are going out and if you are doing something? So that's basically gender identity and gender roles. We are talking about sexual orientation. How do you view yourself? How are you oriented? Then we are talking of issues of reproduction. So it covers a lot of all sectors in a human being, from physical, psychological, social, cultural, and spiritual, which are all dimensions of all of us as human beings. So that's the same that applies to children on the spectrum. And find out in if you look at the statement that the World Health Organization mentioned in 2006, they were saying when you are now talking of sexuality, of reproduction, it is a very sensitive issue, and it requires a very respectful approach. So you have to be very respectful. If you are now mentioning this topic to children, topic to parents, topic to professionals, it's not an issue that you are going to just check. You have to consider a lot of things. So we will cover that a little bit down with these slides and everything. So we have to sort of rush so that it can reach where we want and also finish within the time frame, because at least I see the time is spinning and we're having technical glitches. Okay. So you'd find out if you talk of sexuality without mentioning the legislators and the laws that guides sexuality, sometimes you won't be doing justice. So if you look at the International Governing Board of Laws and everything, you'd find out the United Nations Conventions on the Rights of Persons with Disability. They mention a lot of rights that taps in people with disability, including children on the spectrum. We'll be talking about the right to live, but security of persons, freedom from violence, exploitation, and freedom from abuse. And there is a course that is offered with, in conjunction with the World Health Organization, the United Nations Quality Rights, for those professionals that wants to do something online and for free. That course is very good. You find out it give you a picture of the laws that guide you in dealing with children on the spectrum and even other children with special needs. So you might just go and visit the World Health Organization page and look for United Nations Quality Rights Certificate. You find out it's there. And they have a wide range of laws that will guide you and help you to practice lawfully as a professional without stampeding in the boundaries of each and every one. So it's a good course that you have to take and just yourself. It will help you. So right away, as we mentioned, now we move on to the next topic when we want to define autism, autism spectrum. You'd find out in conclusion, when you talk of sexuality, we are talking of everything that an individual is thinking, feels, and does the entire life. So you'd find out in the audience, there are people that already know what autism is, and some of them that have recently received the diagnosis, and some of the professionals that know what autism is. So what I've done is I have just taken a cut of it, a small portion that we have to explain what do we mean with autism, so that when we highlight the interconnectivity between occupational therapy and autism and sexuality, you'd find out it will be easier for you to really understand and grasp the concept. So what are we talking when we mention about autism? We are talking about, okay, so we are talking about a neurodevelopmental disorder characterized by a triad of impairments, each of which they also linked with a certain behavior. So you'd find out they do have persistent deficit in social communication, social interaction, and they have persistent, repetitive, and very odd behaviors that you'd find out. And they have certain activities, certain places, certain interests that they have. So basically, that's what they do. And basically, if you come to think of autism, this is what we are talking about when you mention autism on the spectrum. So they may exhibit both movements like hand flapping, what we call steaming, all those things, unusual responses to people, attachment to objects, and sometimes you'd find out they are really resistant to change in routine, change in pattern. For example, in the morning, you wake up, they go to dress or they go to bath. After that, then they go to feed. You'd find out to just change that routine into what maybe is required at that particular level is a really difficult issue. At the same time, you'd find out they have issues in terms of sensory sensitivity. They do have sensory issues. So you'd find out so in the sector of persistent social communication and social interaction, you'd find out they can't reciprocate, they can't give feedback on if you say you are talking to them, they can't look you in the eye to just give you feedback of what you want. How are you? Good morning. How are you feeling? To just give you that feedback that they are feeling good and they are enjoying what is happening and everything. They have difficulties in that. Even the way they can approach you, you'd find out people on the spectrum, they are really they possess abnormal social approach, and you'd find out it's really difficult for you to have a normal conversation where you are saying you are speaking, they are replying, you are speaking, they are replying. It's really a struggle. Although it is a spectrum, but this is generally what you see and what we observe in children on the spectrum. So in terms of the non-verbal communicative behaviors, then they have poor communication, be it verbal and non-verbal. They lack facial expression, as I said earlier on. So definitely that is autism spectrum. So you find the others in communication, everything. Some are verbal, some are non-verbal, some can't even pronounce mama, papa, all those things that we would want as parents, all those things that we would want as professional, and even the community, they want to talk with them, and it's not really possible, and sometimes it's very tiresome, you know. So the role of rehabilitation generally on children on the spectrum is to increase their function in each and every domain of their lives and their mental well-being and even quality of life, and including sexuality. as I said earlier on, sexuality, it is at the middle of the lives of everyone, including the children on the autism spectrum. So it is our duty as rehabilitation professionals. Now, what is occupational therapy? So you'd find out the simplest definition that I can give you, you'd find out as occupational therapists, we work in collaboration and conjunction with every professional, every human being, everyone who is connected to our client. I'll use the client or patient. So we do that in order to promote, to prevent, to maintain, and to facilitate independence and functional independence and healthy. So our main goal when we look at a patient, when we look at a client, when we look at people, we would want to take them to their maximum level of function and independence. And it's not that we would want, when you come with the leg and everything, it's not that we will focus on that only, but you find out occupational therapists, they focus on the what we call holistic approach. So in holistic, we're just saying we are focusing on the whole human being. So if you remember the time that I mentioned about sexuality, you find out it encompasses the physical, social, spiritual, physiological, all those aspects of human being. It is our duty. So we would want to see each and every aspect and level of human being reach maximum functional independence and healthy. So you find out generally in sexuality, you'd find out we are talking of each and every aspect of sexuality that we are focusing on. So basically that's OT. So when we want to look now at sexuality and when you look at sexuality and occupational therapy, you'd find out we have got what we call the areas of occupation. And occupation, by definition, we are talking what we do, what matters to us, what matters to children on the spectrum. So we are talking of what matters. You find parents, when they come to centers, when they come to professional, they are saying, he or she is not talking, he or she is not bathing, he or she is not dressing himself. My son is not brushing teeth. My son cannot communicate with others properly. My son is having these sensory issues. If you touch them, you find out he's running, and sometimes he's jumping, running all over the places, non-stop. So you find out in occupational therapy, we have areas of occupation that when the profession was designed, you find out they grouped areas of occupation, areas of what people do in their daily lives in certain categories. So you find out there are activities of daily living that you have to do in the activities that we do on daily basis, like bathing, like dressing, all those things that we have to do. So you'd find out there is also a section that we call instrumental activities of daily living, things that you do for you and for others, like shopping. You go to shopping, you are not shopping for yourself, you are going there, you meet others, you meet a lot of people, you are in constant interaction with the environment to other people. So we have work, we have education, we have play, we have social participation, and we have leisure and sleep. So when we now to transform it to sexuality, you'd find out you wouldn't want a grown-up that is now 19 years old, having difficulties in bathing themselves, having difficulties in just brushing their teeth. Do you think they are going to have any hope of having a relationship, on any hope of having that what we call, we are saying people are interacting? Is there any hope for people to form interactions, all of those things? So it's really difficult, right, if you look at it that way. Same applies. You don't want, if you are saying, okay, let's say marriage or intimacy relationship is okay, but now you are there, you can't do anything, you can't do shopping for the family, you are the father, people are expecting you to go to do shopping. At the same time, when you look at work, you should have some vocational skills, what you do in life. You find out if you ask a grown-up, 33 years, 32, what do you do in life? This is an area that you would want as parents, when they look at their child on the spectrum, you should think about 10 years, the next 10 years to come. Think about 15, 16 years to come. What is your child going to do as a man? What is your child going to do as a woman? You see, so those are the things that you would want to start to train some vocational skills. Knitting, you want them to get into farming, you want them some of them to get into computers, you want them to do a lot of work, something that defines them. As I said, you want the gender roles and gender identity, what it defines you as a human being. You'd want your child to have that one. So education, depending on the level, you'd find out at the same time, you also need to understand some basic concepts. If you are now talking about contraceptives, if you're now talking about menstruation, can you understand it? So depending on where you start and everything, you'd find out it's important, it's something of importance to get to that level. So this is just a general picture of what we would want to do. So I see Grace is asking, how do I get my child to understand money? You see, this is a concept that is developed not in 1 week, not in 1 day, depending on the level of understanding. So what you are saying and asking, Grace, you'd find out it is, if you visit your therapist or your professional, especially your therapist, is graded. You first, you have to know the level of your child to say, what is the level of understanding of my child? So it's not a matter of just running around. So if you visit your therapist, they will do an assessment that will sort of break things to say what can be possible right now. If you are working towards understanding the concept of money, what can we do now? And when are we going to arrive at that goal? So you find out, if you start now visiting your therapist, visiting your professional, they do a sort of referrals and everything. So this is a thing that I'll also answer later, but what you mentioned about the money concept, you'd find out is also under the instrumental activities of daily living, and people can just do that. So I'll also answer these questions, most of them after this lecture, after this presentation, so that we can just do a wrap up, and when you ask questions, then I can take them bit by bit. So you'd find out, as I said earlier, occupational therapy is there to promote, prevent, maintain, treat, and improve function and actually independence. So what it means for, if you are talking of sexuality, so you want you as an occupational therapy, if you are viewing a child who is a 7-year-old, we are targeting on issues like self-concept. Who are you? So we want to develop your child, to get your child in a program that at the end of, let's say, 3 years, at the end of 4 years, at the end of 3 months, depending on the level of assessment, level of understanding assessment, you'd want your child to develop some form of self-concept. Who are you? Self-esteem. We are talking of confidence. You have to engage children in certain activities to say, after this period, they should gain confidence in doing something. Be it going to feeding the ducks, be it going to just bath themselves, be it just brushing the teeth. These are small elements, but they are very important in making our children gain self-esteem. So we are also talking about personal hygiene. This is also under sexuality. You would want a grown-up who is not able to wash their clothes. If we are now talking about 25 years to come from your child, when you look at a child, you wouldn't want someone to having difficulties in personal hygiene. At the same time, they should be appropriate social skills. When you get in the room full of people, what is socially accepted when you get there? So you find out in occupational therapy, we are doing role model, we are training your child. When the child is getting in the classroom, when getting in the autism session, the therapist is asking, how are you? You don't just run there and put the thing and start doing whatever you're doing. You just have to do something that is socially appropriate. Good morning, how are you? I'm okay. today we are going to do, this is what we expect. But if you look at our children and what they are presenting to us right now, you find out many of the children are having difficulties. So we would want to take a child from that point to the point where we say we have achieved appropriate social skills, be it talking in sign language, being it using argumentative other forms of communication. We would want to, at least if they are using that, they should at least resemble what we say is this is appropriate, what is viewed nice and doable in the community. At the same time, grooming about how do you put your clothes. Are you leaving one pattern? Are you zipping your trousers? Are you tying your shoelaces? These are, if you look at it, you might think this is a little thing, but tying shoelaces, if you look at it right now, view it in the next 15, 16, 20 years. When your child is now a grown-up lady, she's dressing, leaving the patterns. She's dressing, leaving the trousers zipped. How would you view it and view them? If you view them, you look at them and meet them in town. A grown-up lady having a jacket weared upside down and then inside out, it won't sound nicely. So these are the things that needs to be done right now, as early as possible. You'd want your child now to understand the concept of shoe tying. You'd want to understand the concept of zipping. You'd want to understand the concept of inside out. If you are saying your trousers, you wear trousers inside out, what do we mean and how can you do that? So these are simple things and you might take it for granted, but if you now look along the continuum of sexuality, from where we are now and from where you are with your child, do you view and see your child in the next 20, 30 years being able to assume things? For us, it's easy. For us, I'm saying for us, for others, not on the spectrum, it's easy. You can just do your children, but it's a struggle for children on the spectrum. But if you introduce the concept later, if you ask the other parents it, on how long did you take for just shoe tie, you'd find out it will be a lot. I can see Grace is she is saying shoeless tying is something that I've been working on, you see. And if you ask these people, you ask them, Grace and other people, you ask them, how long have you taken to do this? You'd find out it's really a struggle. It's not easy. But now these children and these people on the spectrum, we find out the funny or the health thing about working with them. You find out when you are doing this in a routine, in a repetitive things, you find out they are a joy to watch, and you will be surprised and you'll be shocked in how they grasp things. Sometimes fast enough and sometimes slowly, but eventually they reach there. But it needs early intervention, it needs a lot of planning, it needs a lot of time. So at the same time now, if you are looking at sexuality and how to achieve it to where we want, you'd find out a good relationship between the therapist and even new parents. You'd find out it's a gateway to many things. You should have a good relationship with the children. And children, if you want to know something, they are very good assessors and they can see that you don't like them. You are pretending. So you'd find out even if you are made, if you are a parent, show some love. And parents, sometimes you find out when you're talking of loving your children, most of the parents, they show that. But what you get from the child on the spectrum, usually, whether in sessions, whether at home and everything, is a reflection of your love to them. You'd find out that therapeutic relationship, even between the child and the therapist, is the gateway to solving everything. And you'd expect warmth and empathy. And these two terms, warmth and empathy, when you are dealing with children on the spectrum, is they should be on congruent, they should be on point if you want to achieve anything. So what do we do as occupational therapists and as occupational therapy in addressing the issue of sexuality? You'd find out we do music and movement. So if someone might ask you why music and movement, you'd want. So in a grown-up and a grown-up child, you'd find out in music and movement, it's a long thing, and you'd find sometimes we teach music, we teach as a vocational skill, and we teach music as a relaxation, something we want children to just relax. As you listen to your music and to your song, you might relax, and you'd find out if you do it in group sessions, it sort of promotes social interaction between children. And it's a lot of topic that you'd find in different therapies, they take it differently. Because you'd find sometimes even children might be having sensory issues with audio and everything, but generally music and movement, when you're talking of music and movement, there are a lot of things under that, but these are the things that you'd want to do with your child. And why do we do music and movement? If you are saying now vocational skill, this is what we want for the child to do in the next 5 to 3 months or even 10 years to come. If now he's good on the keyboard. So on the end of this presentation, there is a page that I would like you to follow on the guy who is called Lee. You'd find out he is very good in music, but at the same time, he's autistic and even blind. But if you look how good he is, you'll be surprised. So you find out there are certain children that are very good with things like music and getting to understand the keys, how the keys work and everything. Some of them, they are very gifted in that area. So you might teach them as a vocational skill. You might also teach it in a group session. People should just also relax, interact with each other. And it's a good activity that you find occupational therapists are doing and promoting this. If you remember the previous point I mentioned about the area of occupations, you find there is leisure, there is play in children. So now if your child is not a teenager, we are talking of play, and that's the work of children. So if you do music, we are playing with them and we are teaching them. At the same time, it's relaxation. You also make them forget some of the things, and also is a stress management skill. Fan therapists, they do that a lot with children. Then also you'd find out therapists, they teach social skills. You'd find out you teach social skills as a therapist in different platforms and different areas. You be addressing communication, yeah, you'll be addressing on birthdays, on playing volleyball on the grounds. A lot of areas you teach social skills, which is very crucial when you get back to sexuality, you see. Now, you also do role play and psychodrama. You would want to measure whether a child now is he confident enough. So you would want to facilitate increase in self-esteem. You go there, be like Jesus, maybe you're doing a drama of Jesus and everything. Can you stand in front of the audience? Just read the first paragraph if you are reading and in front of the people. So you'd want to increase this. So you also, the parents would want to feel lovable. You see, if some of the children are saying, hi, nice one, that's good, and some of the children are clapping hands for your child, it's a good feeling. You would feel lovable, wanted in that environment, and it's also part of sexuality that you'd want your child to have. It's a certain aspect. So at the same time, you'll be addressing issues of self-esteem, poor self-concept. Who am I? What can I do? You also engage children in expressive arts. At least, you know, sometimes if you are now, let's do art, drawing people and everything. Some of the things that children on the spectrum would draw to you, they will show you what they are thinking emotionally and what happened to them even on the holidays. You'd find out issues of abuse. Some of the issues of abuse, you might find them being drawn on a piece of paper. You see? So these are the activities that we do, and you'd find out now that we are talking of sexuality. Some, I hope parents are now realizing on what is the target and what area is being addressed when you are talking of sexuality. So basically, this is how your occupational therapist will be looking at your child when they are doing activities. You see, let's get in the drama, let's do art, let's draw human beings, let's draw mama, let's draw papa, let's draw this. This is the things that you'd want. And they express themselves wisely doing that. It is done in a professional manner. You'd find that. So at the same time, you'd want to minimize the feelings of worthlessness and even of hopelessness. So you'd find out in role play, in art, all those things, they will come out while you are having your session. You see? So now the connectivity that I will mention, you discover, even when I was talking, you discover the interconnectivity between these terms and everything. You see? So it would require for therapists, you do require to understand what is socially acceptable and what can I address right now and what can I not do. And sometimes you find out with this topic of sexuality, it's not the occupational therapist knows it, or you'd find out this is a platform in an area where you need a lot of collaboration between parents, between yourself, between the other people working with the children. And it's a topic where you can't break as a therapist to say, I can do this all alone. You find out it's very, very important to work with the parent. At the same time, the parents will tell you sometimes the maid is available and she is the one who's having the child 24/7. So sometimes you find out it's also very helpful to get in touch with the maid, to get in touch with the caregiver, one who is having the child. And you'd find out if you do that, you get the best out of for your child, you get the best out of what you want to achieve from on the child, you see. So as the therapist, you need to analyze all these concepts, you need to view all these things and now formulate your plan after consulting a lot of people, you see. And sexuality, things that you should also remember on this one, is a private and sensitive matter. So you have to be very, very careful. Some of the things as a therapist, as a male therapist, you can't do it with a female child and everything. So you have to really be on the notch and also consult others, as I said earlier on, because it will raise a lot of ethical and social culture and social issues. So there is an issue that parents should also realize when we are talking of autism, and now I'm talking of, can you start now? And some of the parents would ask, why should I start now? And if I don't start now, what are the things that might happen and things that might come up later? You'd find out now children on the spectrum, when they are below 18 years, they are still on the spectrum. But now when they are more than 18 years, most of them, you might say they are on the spectrum, but most of them usually they will tend to a mental condition that we call schizophrenia. So you'd find out with schizophrenia a little bit, let me just give you a little bit of it. You'd find out it has got positive symptoms where we are talking of delusions, hallucination. Then there is what they call negative symptoms. These are the symptoms that we see in children on the spectrum. So if you don't address social interaction now, if you don't address hand flapping now, if you don't address running around where they are hyperactivity, if you don't address them now, you'd find out after 18 if they are presenting the same. You'd find out if you go to a doctor and they do their diagnosis, sometimes you'd find out the diagnosis will be schizophrenia. You see, and this is not a thing that you'd want for your child. Let's deal with the issues now. Let's deal with the hand flaming. Let's deal with the stimming. Let's deal with teletraining now. Let's deal with social interaction. Let's deal with communication now. You see, before we move on and things start to appear later in the late stages. And yes, you know, you can't teach all dogs new tricks, and it's something that as parents we should maximize and on the time that we have now when the children are at least before teenager. Okay, So you'd find out, I just have highlighted some of the main areas when you talk about sexuality. So we'd want your child, the ultimate goals that would want as parents, as professional, you'd want, finally, we should execute good personal hygiene and grooming. And I've given some of the, examples of what can we do now in training, bathing, grooming, and what can happen in the 20, 30 next years to come if we don't address it now. So I think that one we've mentioned. Also to exhibit a positive sexual self-image. So self-image, what are we talking? We are talking about self-respect, self-worth, attractiveness, acceptance of you or you are. So you'd find out these are the things that you teach while a child is growing up, and you create an environment where the child is feeling respected, having their private space, owning up to say I'm this and I'm loved here. You see, those are the things. And at the same time, there are things that we need to address. You find out children, it is very important for each and everyone, even the one who is not on the spectrum, should have the ability to give and receive physical touch. So just imagine your child when they are now 23 years now. If someone tries to touch them, they are now moving away from them. Probably it will be issues of sensory defensiveness, where you are saying they have sensory issues, and if you touch them, it will trigger something else. You see? So if you can manage the sensory issue, the tactical defensiveness right now, while they are young, so that they are getting used to being touched, they are getting used to heavy touch, it will be a good thing, because you can't have a partner that now is refusing to be touched. Now at 30 years, at 35 years, it will make the other partner feel unwanted, you see, and it won't turn up nice. So you find out even when now we are talking of someone who is in need of constant touch, you see, tactile hypersensitivity. Someone, children who would want, you find, if you look at on the spectrum, there are children that have got tactile hypersensitive, they need touch. So you'd find out they are satisfied when you gave them bear hugs, all of those things. If you put at least a heavy touch on them, they will be now nice. But you wouldn't find a grown-up young lady at the age of 23, 24, now they are still having those problems and they just want to have a bear hug. And sometimes it might be interpreted wrongly in our society, because people, some of the people, they don't understand the condition and everything. So they might take it in a wrong way, and it won't turn up nice. You find out. So it's better to deal with it now. You go to your therapist, they do their assessment, they have their sensory profile, they give you the activities that you can do in the comfort of the home, and you come and visit your therapist, they give you those certain activities to deal with sensory issues. It might be in form of tactical. It's just an example that I've given you in terms of touch, smell, proprioception, height, vestibular. That all of our senses can have sensory issues, and it's common in children on the spectrum. So it's also good to have them sorted now, you see, than later. Okay. Are there programs to empower parents and caregivers in special needs? Okay. So I have to take these questions down while I'm also presenting, so that I can just answer them later, Then, okay. So after you define that, also you need your child to have that ability to be intimate. And this is things you work it from in the beginning. The child also have the ability and to give and receive affection. So you'd find out things that meant a lot, that can be affectionate. Making a birthday gift, a birthday card for a child who is on the spectrum. Now you do an activity, he or she makes that one. it makes their world differently, and they enjoy that thing. You'd find out these are the things that you'd want to do. Throwing things like throwing a birthday party, the children, they feel loved, and they feel the affection, they receive the affection. They received in different manners and formats, but trust me, they enjoy those things. So these are the things that you would find therapists now. Your therapist is taking your child, they are doing an art session, they are making a birthday card gift. They are going there, you were saying we have got a birthday party, and they are hosting a birthday, and you would maybe say, why are you doing this? These are the reasons, you know. They need to communicate, they need to receive affection. Some people, some of the children cheering up for them. Happy birthday to you. You see, they sort of, it makes sense in them, and it rings in them to say, no, I'm loved here. And this is the thing that you'd want a grown-up individual to also feel and possess. So the ability to communicate effectively, the ability to form healthy relationships. So you find out in relationship, you have got boundaries. How do you say boundaries? You make boundaries, you set rules in a relationship. So if you are not able to communicate effectively, be it in picture format, be it in verbal, you know, it won't turn up nice in the relationship. And these are the things you need to start to introduce now. You see, the ability to form a healthy relationship and to appropriately channel sex energy. And ultimately, you'd want eventually, when your child now is turning 16, 17, 18, depending on your assessment and their level of assessment now, you'd want your child to understand the factual information regarding STIs, use of contraceptives, and all of them, which is also under sexuality. So you find out what you do now, the building blocks that you do at their early stage would also facilitate and allow you as a therapist to reach that levels if you do it a little bit early. Now, so I've talked a lot, and I think we need to focus on more common problems that we experience in children when we are talking of sexuality, you see. And I can see in the messages, the matter of sexuality is very challenging. Yes, of course, it's very challenging, you see, and it's very broad. And you can't mention, as I mentioned earlier, you can't deal with it alone. You see, now Kelly Bon is talking about sexual abuse. We need to educate them, and which is very true. It's happening all over the areas, and these children are vulnerable. You find out as a therapist, as parents, everyone that understand conditions like autism, cerebral palsy, and everything. We should act as advocates, and sometimes you end up standing for them, because eventually it becomes a job. So you would stand up for their sexual abuse, you'd stand up for issues like what he's talking about, and it's very, very challenging, man. And collaboration now between parents, between the community, between the police and everything is going to make this better. But all the other issue, you'll find out even education, we need to educate them now. On education, we need to start it as early as possible so that they understand the concept of education, you know. So if you do it early, even then you'd find out if you are doing repetitions and everything, you'd find out you are in a better position to address the issues of abuse. What is abuse, so that the child will realize, no, this is not right. It's not sounding right. But you find out in the minimum, now, you find some of the things they might not even realize whether is it right and is not okay. So all those things we need to start early, and also consult and also record these things and everything. So I'll also give some of the tips that are going to apply in each and every scenario in how to go about this, because I'm talking as a professional, but sometimes parents would want to say, what can we do in the comfort of our homes? What can we do if we are faced with this problem? What can we do to manage there, and how are we going to do it at least if the therapist is not there, at least if a professional is not there, some of the things you should do it in the comfort of your home. So now the common problem that I've tackled here is a big topic. You find out there is adolescence. So in adolescence now, issues of sexuality, they tend to appear more, where children are trying to find their balance with the hormones, trying to balance find their balance in their identity. Who are we? You find out even children who are not on the spectrum, when they turn into their teen years to be a teenager, this is a period where each and everyone is trying to figure out what is happening with me and what is happening out there and how can I be gay successfully out there, you see. So basically, this is a period where you'd want to address, and most of the problems, they arise in this period. So generally, adolescence, you find out, is a period of these turmoil, unexpected dynamics, physiologically, neurologically, psychologically, and even interpersonally. So there is, in parents, you'd find now parents, they are in anxiety mode, where they are saying, what is the right time to address this issue? You see, parents are now figuring it out. They are changing their children, but now they look at their children and they are not so sure, when can I start to address this issue? So you'll find out parents will be managing issues of their own personal discomfort, and they have fears that they have. What is going to happen if I introduce this topic right now? Is it going to sink in? Is it going to help? And what is going to happen if I introduce this topic right now? So on this note, you'd find out the best thing and the best answer that I can give to parents is know your child. Record information on the progress of the child. It's easier now to take it from your recorded information to say, I think this is the right time. But most importantly, it's very, very good to have a professional answer and a professional chipping in to say, no, this is the level of understanding of a child. We have assessed through this and we have done this, and look how he or she is performing now. So it gives you a standardized and a formal answer that helps you to make a decision to say, no, this is the right time to teach the topic, to introduce the topic, and move on. And also, communication between all the parties is very vital. And what do we mean with between all parties? As I mentioned earlier on, is in between. It's in between the professional, be it the therapist, physio, speech therapist, and the parents, and also a member that is usually taken out of this team, the way I say all parties. A caregiver, most people, when they are doing this, parents will just rush to the professional. They leave the maid, and the maid, you find out the caregiver is the one who's having the child all day. And you go there to the professional and you address also a half-cooked, and the professional will do a half-cooked assessment. And you find out what comes out there is not exactly what's going to help your child. You leave some of the gaps that might even address some of the issues that are starting to pop up. And if you are recording now the progress of your child, you find out it's easier to pinpoint when it started and to pinpoint some of the areas that you consider as a priority as a parent, because you are the one who's having the child most of the times. And also in adolescence, referrals are common. And as I said earlier on, is a topic where you'd find out you can't address everything alone. Be it a parent, be it a law enforcement, be it a therapist, everything. So common problems that you find out parents will complain about their children touching and talking about sex in public. And you'd find out it's very common, parents complain about that issues, and you find out since they are on the spectrum, you can't predict what they do, children, but if you start to hammer those issues as early as possible to say this is not socially appropriate, as I said earlier on when I was defining autism spectrum, you find out your child will have that certain understanding to say this is not acceptable. But sometimes some of them, we find out they have short-term memory, they have cognition that is a little bit low. That's why you find out we have got high functional, we have got mild function and low functional. So these are common problems where you find out children will be touching and touching themselves. Sometimes there is no intention of doing anything, but they're just touching themselves, and they are doing it in a public place. They are talking about sex in a public place. Then you find out it is common now in this period for their behaviors to be misinterpretation. You find out it's a very common way. Even parents and their professional, they get these behavioral cues wrongly. So you'd find out lack of privacy and familiar environment and under-stimulating environment may present with frustrations, and that's why sometimes they are exhibiting this kind of behaviors. You see, so generally that's it. You find out some of things they are frustrated, they are trying to vent out, they are trying to communicate their frustrations, and they do it in a very awkward manner, in something that we would want. Okay, so now you'd find out there is a topic of masturbation. When you talk of sexuality, there are a lot of things, but masturbation is a thing that you would find out most parents complaining. And I've taken the time to just sit down and plan it for you, for parents, so that what can you do when now your child is now doing it. So you'd find out the children, they were masturbating in appropriate locations and using other means that are not cool. And you find out is sometimes they get frustrated even before and after, and they throw tantrums which are not good. And sometimes they injure themselves during that behaviors. So sometimes it's also good to have this background mind to say what are the possible reasons for this kind of behaviors. You find out some they do it for relaxation, some they do it for physical pleasure, and some they do it for falling asleep. Then some they do it to relieve sexual tension, and some they just enjoy to do it as So these are possible reasons that you should click on the back of the mind when you see your child doing this, and even you see your relative now doing it on the spectrum. Okay, so you'd find out it's more common in males than in females, this kind of behavior. And when now it interferes with daily routines, it interferes with social norms, and even sometimes it makes you uncomfortable as a parent. You have your child, even some friends might even understanding what autism is, but sometimes it gets them frustrated, and sometimes it won't. It leaves you not feeling nicely about it. So you'd find out one thing that you should also understand when they are doing it. The problem is that the children doesn't know what is right, not the act, whether they in their brain they don't know what is right. So you find out sometimes if you hammer this early, sometimes you have got a better chance of solving this and everything. So you find that it's good. That's why I was mentioning it's good to start it early and everything. So it can be really stressful for parents, caregivers, community, and even professional. You want to do a session and then they start to do that. And it leaves you in a position which is not good. So how do you handle it as a parent? How do you handle it and in the comfort of home and everything? So one thing that you should do and should monitor is to realize the child's level of understanding before considering any method or any suggestion that you have to hear maybe in a group and everything. So for this, you have to consult your professional. You reach out to other parents and find a professional who gives you a certain level of understanding. And most of the time, you find that the professionals that are spending most of the time the children, they are really equipped to offer that. And with professional, we're talking about occupational therapies, visio occupational therapy, they do the assessment. And if there is something that is needed before even you suggest, they refer you to certain professionals like psychologists, pediatricians, all those speech therapists, so that they can just give you a formal and standardized information and measure. You see, you'd find out sometimes the source, where is it coming from? Sometimes is coming from the environment. You'd find out you leave your child with your uncle, you leave your child with your certain relative. Now you find them starting to do this kind of acts. So sometimes it's also good to figure out the source of your problem. Even the likelihood, just say a likely is likely coming from this. And that's when the importance of recording and consistency comes in now. You find out if you are recording your child. And I want to stress about recording. It's not the duty of a caregiver to do that. You as a parent should make it your job to record. If you are saying your child is taking meals 3 times per day and is taking meals, a certain dietary plan, you say you as parents should make sure you are on top of it, you record, you make it your job as parents to supervise now. For some of you will be working, so it's good to just make sure the recordings are done. Just to note some certain behaviors, it's easy to note some changes. And also, it's also good to inquire how are the other parties viewing this and what they are concerned. And you'd also want to consider the vocabulary that is being used in talking about these things. It also is a way of doing that. So how do you do this? You must facilitate and make sure that you keep the child busy. And specifically, what are we taking? We are talking about the hands. Give them activities where they can be engaged with their hands. Some doing something with their hands, doing something. You redirect their energy to a purposeful activity. Like what? You go, you do the cleaning, you do washing of clothes, and if you are recording, you are likely to be in a position to note the certain time frame that they do this. You engage in something that they enjoy doing, like you go to feed the kids, you feed the rabbits, you go to do also that they keep their mind engaged, and it makes them focus and channel their mind towards that, something that is engaging. So you also have to make sure you demarcate and make it clear. Sometimes in a picture format, it's also good to say this is a public and a private space. So if you are at home, sometimes it's also good to make sure that you put notices to make it clear for the children to realize, no, this is a private space and this is a public space. So if you are saying, let's go to the private space, for them, they shouldn't struggle to figure out where exactly are we saying we are going. They should their minds should switch on to if it is their room, then that's it. Where there's a picture, that's the private space. So if they are now doing that, instead of saying, don't do that, you say, let's go to the private room. You see, let's do this. Let's go to the private room. That way, it makes them realize, no, this is a public space. No, people are always, when I do this at this place, people are always concerned. And instead of stopping me, they are offering this. So you find out their brain will realize, no, man, this is not a place to do what I'm doing. And their mind will easily follow and go to the private space, which is a plus. If you see them now realizing the private versus public, you see. And at the same time, as I alluded earlier on, recording is very good and early identification. Just imagine you started to record your child at 4 years. You know the behaviors, you know what he's going to do at 4 years. And now someone wants to start to record at 26 years. Yes, you get results, but someone who started earlier on has got a better return than someone who started at 25 years. And also you must also be creative with children. You find out sometimes it's not easy and appropriate to speak to them. Some of them, they don't understand it. They can't even return back the information. Some of them, they're non-verbal. So you use what you call argumentative illustrations. And sometimes the best way for argumentative, we are just mentioning some ways of communicating, which is not necessarily verbal. You see, so sometimes you need to consider using visuals. As I said, pictures to say this is a private. You write it a private. If it is Tom, the child is Tom's private space. You see, and this is where we do dressing. This is where we do something. Even when now he is starting to do masturbation, if you say, let's go to the private space, you see, sometimes Tom will just go to the private space and do that. And in that way, cases of embarrassment in front of your friends and everything, they are lower. At the same time, it rings inside them. And you see, it makes them realize. And also, there is what we call picture stories. So if you are having picture stories, they will be designed to teach the concept of masturbation, to say this is not socially appropriate. So you decide to find out the therapist, and sometimes there are certain designs that you do picture stories where you are saying this is not acceptable, and they take it slow, but eventually you find out some of them, they would actually figure it out and realize this is actually what is needed, what is socially appropriate, what is not required here. And they really appreciate, and some of them you find results. And you shouldn't put a lot of information, just put a simple and straightforward languages in doing those signs and communications. You see, so sometimes you have to be firm when you are talking to children on the spectrum. And firm, sometimes your facial expression should also highlight that you are not joking. This is a serious issue. You see, and sometimes the best way to do that, the children, they are very, they understand and analyze you. So sometimes it's very good to manage your tone as a parent. So if your tone is saying, Tom, let's not do that, it sounds as if you are playing with them. But if you say, Tom, let's go to the private space, you'd find out Tom is likely to respond and say, Tom, in a relaxed tone. And sometimes your face should tell Tom that this is not acceptable. This is not this is not what is needed, right? At the same time, there's this also tip that I find it very helpful. Sometimes naming masturbation another name is a good way for them to realize and make your child, make it socially sounding. Sometimes it won't trigger your friends, it won't trigger your relatives, it won't trigger the community. So some of the names that you can give it, you can say, if he wants to go there, just say private. You can, if you just switch even private space. So if you see a child going, say private, then you know sometimes it's likely to happen, and they would just go to their private space. You know, this is the time, because it's really disturbing sometimes. So if you do that, you are likely to get a better understanding and a better resolution on the matter than to just name it as it is. Sometimes they say few good moments, and you can say name it that, and children are likely to listen that, and they can go there, than to just pinpoint it. And sometimes if they now realize it, and it won't sound nice. So, and I repeat, let's do the do words instead of don't do that. Because whenever you say don't do that, the child will sort of panic, and now they are ready to do the right thing, but they don't know what's the right thing to do. So if we continue to do, don't do that, exactly, they want to stop what they are doing, but they are not sure what are we supposed to do. So instead of saying, don't do that, let's say, let's go there, let's do this, let's do this, offer an option where your child has to have an option to say, no, this is the right option that is being offered. And it means what I'm doing now is not the right option that we want. So if you are dealing with them and saying that you are in a better position to have a nice response. So also menstruation is another issue that you find out in teenage children on the spectrum. You find out parents are having difficulties in managing children on this and menstruation. You find out it's really tricky even on managing it. As I said earlier on, sometimes it's not appropriate and it's not sounding nice for a male therapist to go and address certain issues on menstruation, and sometimes you would need to consult and refer, or to consult and let someone do on your behalf. So as I said earlier on, this kind of a problem, this kind of an issue requires multidisciplinary approach where you have to be friends with the caregiver, friends with the one who's cleaning the lawn, friends with the one who's cleaning there, so that when you are presented with a problem, you are in a position to say, can you help me on this and this? So it requires a multidisciplinary approach. Even on professional, you find out as a therapist, I might address certain issues, but I do have limitations on certain. So it's also good to say, can you go and visit your psychologist on this issue? Can you go and visit your speech therapist on this issue? Then you find out on this issue also, family is very central and is vital to decision making. Eventually, sometimes you'd want to consider contraceptives. How do you do that? So you find out the family is on the forefront. They are the final decision makers. So you as a therapist, you as someone who's working with the child, sometimes you have to realize that family is vital to making the decision. Also, and there are different views and values, and it might also impact your therapy if you don't realize the different views and values that are attached to issues like these ones. Okay, so how do you handle menstruation and how do you have it? You see, you'd find out it's very important to keep a calendar for children for this issue. Even you are a therapist at the center having children, it's very good to keep a calendar. And sometimes it's very good, also very helpful to wear a calendar, to wear a pad prior to expected menses. So to prepare in advance, it's a very helpful thing. You find out also practice wearing these pads and tampons on different sizes and styles to figure out which are comfortable, you know. And instead of just judge to say, I think now this is the time, I think they are now approaching this, now I think it's likely to happen. It's very, very good sometimes to use a schedule where you have a time frame where you are saying, no, this is a schedule. If they are not going to do it in this time frame and everything, you prepare along that. So when it is not doing that, then you see, then keep a supply of hygiene gear at home and everything. And it helps you to help that. Then sometimes you can't figure out, and sometimes you can't do it. Sometimes if you are not well informed, sometimes, you know, it's also good to consult other professionals. It's also good to consult other people involved, you see. Then there's sometimes where you need to consider continuous hormonal therapy and use of contraceptive, and you find out the contraception sometimes they help for hygiene issues stemming from the use of, because when the children, when they're on the spectrum, they are taking antipsychotics and other medications, so you find out the hygiene issues associated during this time frame and everything. So birth control is Kedibone is saying is another, you see, is another thing, and it's also advisable to put girls on menstruation, you see. But at the same time, you'd find out it's also good to consult with the family Some would say we don't want to put them in the family planning, and sometimes you can't force them, you see. So it's also good to consult them. But what you are saying, Keribone, is a nice thing, and it's a good move, you see. And it's something that you are talking is something that is recommended as well. And thank you for that. So I've mentioned this one. You'd find out I've also sort of exhausted a lot of things. Then in conclusion, in taking summary of this, you'd find out, as I said earlier on, sexuality is an integral part of every human being, and so are children on the spectrum. So it's very vital. As I said earlier on, you'd find out I was stretching sexuality to areas like being physical, being physiological, being spiritual, being a psychosocial issue, where it spreads in areas that are different. You find out under sexuality, there are many topics that we should talk about. People might choose to talk about. You might even talk about sexual abuse, still sexuality. You talk about gender identity, still sexuality. So it stretches in all areas. You see, the ability to form a relationship, to be involved in social participation, to be involved in activities of daily living, do something, all they stem up and they have integral parties in sexuality. So it's very an integral party. So as I said earlier on, another point that I would like to stress, you find out occupational therapy doesn't look at the child when you come with your child and you bring them to the occupational therapist, they look at each and every area. And you'd find out, as I was explaining earlier on, every activity that your therapist will be doing your child will help your child to address issues of sexuality. Maybe now, sometimes after 3 months, sometimes after 3 weeks, and sometimes for the whole of their lives, we are addressing sexuality. Then we also I stress the importance of recording and consistency when it comes to children on the spectrum. As I said, you'd find out it's easier to note certain difficulties, changes in behaviors, changes in certain issues, changes in certain routines. You'd find out it's easier to note that when you are doing a recording. And the one person who is supposed to manage this and to be on top of their game is the parents. Parents should be in a position to know that what is the level of understanding of my child. Currently, what are the problems and the areas that my child is good, and which are the areas that might need intervention, you see? And you'd find out even when occupational therapy offers these areas and address a collaboration in a multidisciplinary team is very effective in addressing sexuality and even generally in making children on the spectrum better. So to get the best out of the children, you find out collaboration and multidisciplinary team is very good. Also, improvement now, I would want to stress, is guaranteed when parents are more active in their children's life, as I said earlier on. And you'd find out what, in the beginning, what I was talking, this presentation and this webinar was also intended on giving parents an eagle's view on their children's lives, on children on spectrum, and even on children on other conditions like cerebral palsy and everything. You find out if you can have an eagle's view to say, now these are the problems my child is facing, and what can I do now so that in 5 years to come, in that area to come, in that next stage to come, can she or he be able to do this independently? Can she be able to do this appropriately? So you find out this presentation was designed to give you as parents and attendees an oversight to say what is going to be needed later. And if we don't do this now, what is going to happen later in the late stages, whether you'll be there as a parent or whether sometimes you are not there, what is going to happen, all of those things. So this was the the aim of this presentation. So these are also helpful resources that might help you as parents and to look out and see some of the issues that I was mentioning and the impacts, and even why I was stressing that sometimes it's good to be ahead and in control of your child's development. So you find out there is a page that if you say no, if in the Americans they do it better, there's this page where they say it's called My Journey with Autism, which is there on the Facebook. Just look at it, and sometimes you'll be very much inspired with the parent that is taking initiative on making their child is better. So you see real issues. Now, I'm not sure what is the girl, but you'd find out the parents have done a lot of things to make it happen, to make what they are uploading now. And you can see when you are looking at their journey and reading that story that it is a struggle. And if you don't record, if you don't have that on top of the game as a parent, you are likely to face some problems. So this is a nice thing. And then there is a guy called Lee. You should just follow him. He won America Has Got Talent. He's autistic at the same time. He's blind, but he is very, very good when it comes to okay. To look for him, you have to and